Healthcare is broken, still, for most people, as you've probably noticed. Chances are the healthcare premiums for you and your family are shooting up. The costs are insane. And if some medical crisis should happen, even the deductibles and copays are huge. Your health plan treats you like a criminal. Or you're a doctor or a nurse, you run a hospital or a clinic, and the whole way you keep the lights on and pay the bills is being turned inside out. Or you're an employer. Healthcare costs are killing you, and you feel like there's nothing you can do about it. You're an entrepreneur or an investor. You've got a startup trying to build new tech to make healthcare better, faster, cheaper, and the system you're trying to build it for makes no sense. U.S. healthcare costs twice what it needs to. A third of all of it is waste. Millions still have no access or can't afford to use it even if they are covered. Still, the most common cause of bankruptcy is medical bills. Even with Obamacare in place, premiums are jumping, there are big deductibles, copays. Our medical care is killing us. You know this. Healthcare in the U.S. is broken. Single payer? Medicare for all? Is it the big answer? Not big enough. It might help, might cost a little less, won't by itself fix the system, won't cost half as much. And half the cost for better care for everyone is exactly where we can get to. And it's exactly where we should aim, half the cost or less. Healthcare is broken. Who can fix it? We can fix it. Who's we? Now, this may sound strange, but hear me out. The people who do healthcare can fix it, and the people who buy healthcare can fix it. How could that be? Listen. Every buying decision shapes healthcare, and the people who are selling are listening. But how do we make that change? How do we get much better healthcare for much less? Well, there are new tools that are emerging, new technologies, new ways of paying for healthcare, smart new strategies for running it, new ways of shopping for it. But we have to know how to use them to get what we want, better, cheaper healthcare without rationing. Here's how. How to get what we pay for. A handbook for healthcare revolutionaries. I'm Joe Flower. I'm a healthcare futurist. For 35 years, I've been writing and speaking about the future of healthcare, working with health systems, governments around the world, employers, consumer groups, helping them get real about the big changes, demographics, economics, technological changes that are finally happening right now to overturn the way we have run and paid for healthcare. Why did I write this book? Because it's time. I'm on a mission here. I'm passionate about making this crazy system work better for all of us. And now we finally have a chance. In How to Get What We Pay For, a handbook for healthcare revolutionaries, I first explain how we got here, the actual roots and causes of the enormous cost and waste in healthcare in ways you may not have heard before. I explain that because once we understand how we got here, then we can see how to reverse that tide of insane waste and the bizarre costs inflicted on us. Then we get to the good news, the 7 levers of change that are forcing the system into new shapes. Each of the 7 chapters has checklists and resources for each one of you for taking action, whether you are an ordinary patient or family, a doctor, nurse, a healthcare executive, an employer or a pension plan, an entrepreneur or investor. Checklists, resources that will set you up to make this happen. That's the good news. The even better news? By becoming better shoppers for healthcare, insisting on results, voting with our dollars, forcing the system to meet our needs, with every action step you take, you will be getting a better deal. Better, cheaper healthcare for yourself and your family. And you will be building a better system. Which leads to the surprise twist. We don't need to change the whole system to change the whole system. Now, I know that's confusing. Stick with me here. I'll explain. Healthcare is what is known in system science as a complex adaptive system. It's in the nature of such systems that you only have to change 15% or 20% before the system itself begins to remold entirely into the new shape. That's what it's doing right now. We are actually approaching that tipping point. None of this is theory. This is happening now in pockets, leading edges, advanced systems all across healthcare. You can join the ranks of revolutionaries who are already pushing hard on this system to get what we pay for. How? In this book, I'll show you how you can easily get hit with huge medical bills, even if you're insured, and why step number one is don't pay them. If you're an employer, I'll show you why some employees are eating up half the healthcare costs and why the best way to lower their cost is to get them better care. If you're an investor, I'll show you where the real markets are in healthcare, not the ones that you hear about from people who may not be thinking globally. If you run a healthcare system, I'll show you how to stop taking the old risks and instead take the right risks so that you can do better by helping make the whole community healthier. So seriously, whatever part you play, you need this book. It's a real how-to, a handbook for healthcare revolutionaries. That is, for you.